A very good morning to you. I'm Howard Feldman. This is the Sunday Synthesis Podcast with me, Howard Feldman, and of course, pulmonologist and physician, Dr. Anton Meyberg. It is the 21st of February 2021, and South Africa began in the last week to roll out its vaccine program yet again. How is it going? Dr. Meyberg, good morning. I'm assuming that you are fully Johnsoned.
Good morning, and today we can make no assumptions. There's no time for assumptions in South Africa. We've just got to go with the facts and go with the reality of the situation. As we're sitting here at this time on Sunday morning, I have not been Johnsoned, if you want to coin that term. A number of people are still waiting to get their Johnson & Johnson vaccine, and I think we'll go into discussing that a little bit later. But we currently
hold on.
100.
All right, so carry on with that, and then we'll come back to that because I'm a bit perplexed.
Oh, there's a surprise. Okay, so there currently are 111,689,821 cases worldwide, with 2.47 million deaths and 86 million cases resolved. The United States has 28.7 million cases with 509,000 deaths, and South Africa has 1,502,367 cases with 48,940 deaths and 1,690 new cases in the last 24 hours, a recovery rate of 93.8%. There are currently over 10,000 vaccines that have been so far administered in South Africa. The Gauteng hospitals have now got 3,576 cases with 576 in ICU and 346 ventilated. The admission numbers, the ICU numbers, the ventilation numbers are down. In summary, the cases throughout the country are down by 25%. The test positivity rate is down by 22%. The hospitalization number is down by 28%. And the death rate is down by 32%.
So overall, that's incredible news. It's almost like we're at that valley before, at the stage between surges or waves.
As long as not the valley of the shadow of the graves, we should be doing okay.
No, valley of the shadow of death and all of that. Yes, indeed. So so the numbers are looking good. The hospitalizations are down. We kind of the kids are back at school. Overall, from that perspective, we're in reasonable shape at the moment.
Correct. That doesn't mean, though, we can stop doing any of the necessary measures. We've still got to maintain our social distancing. We still got to wear our masks. We still got to hand sanitize, and we still got to be very strict. Because if you remember, this is when we had our last surge or post-rage surge, when people dropped their guard and just went out and did what they thought they needed to do. And this is especially pertinent with the Purim festival coming up, which is quite a social event, which we also need to discuss.
Right, yeah, we will definitely be talking about that. Let's just talk about vaccines. The South African rollout has begun. To me, looking at it from this side, it seems like just a little bit of a circus. I don't want to put words in your mouth. You've said you haven't got the vaccine. Have you been informed as to when you will get the vaccine? When will you be vaccinated?
So I found out late last night that I've now been registered for the vaccine. I eagerly went onto the vaccine site to register for it and was told that the vaccine site is full. Please try again later. And what we're seeing throughout Gauteng at the moment was a number of GPs had registered for the vaccine and they were going for the vaccine today. Only to be told that Baragwanath is not running today because it's a weekend. So on Sunday, the 21st of February, Baragwanath, one of the biggest hospitals in the Southern Hemisphere, is not running for vaccinations because they don't work on Sundays. So a lot of the GPs and a lot of the other doctors have gone to Steve Biko Hospital for their vaccinations, where there's absolute chaos. Over 2,000 people are there. There's chaos, there's anarchy. People are queuing together in an environment that looks like it's going to be the next rage event, basically. It's a social spreading event where everyone's on top of each other. They don't have enough vaccines for the people. They don't have enough facilities for that amount of people to be there at once. And some of the forums are actually telling the members to leave and come back at a later date rather than expose themselves to this amount of people. So I think with the word you said was circus, I think a circus is something pleasant at times, but this is worse than a circus. This is just completely ridiculous.
Well, just for the record, I hate circuses, so that would be apt for my usage of it. It's honestly absurd. So I just to get my head around this. So you have spent a good portion of the last year in the COVID ward. You spend every Sunday, whether you're working or whether you are on leave, have a weekend off, informing people about COVID. You sit on various boards for educational facilities, advising people around what to do, schools and other institutions around what to do with COVID. And you, to date, have no idea when you are getting that vaccine.
I wish I could argue with you, but that is correct. Right now, where I'm sitting, I have no idea when I'm getting the vaccine. But being said, Netcare, the hospital which I work for, is fighting fervently for their doctors to be vaccinated as soon as possible. They've put in a major effort. They've put in a lot of hard work, and they are working extremely hard to try and get us vaccinated. So thank God for that, because the government has let us down. At least hopefully the private hospital boards can get us vaccinated sooner than we were going to be vaccinated.
Absolutely absurd. It must be enormously frustrating for you, knowing what you've been through and what you continue to go through, and that you aren't worthy of being allocated a slot to get a vaccine. As is the same with your nursing staff, your colleagues, and your
well, that's
the
what I
other
was going to
medical
say.
professionals.
I'm not in this alone. It's not
100%.
only me. You know, all of the doctors in private on the front lines, all of the nurses, all of the physiotherapists, all of the OTs and the speech therapists, all of those people who are working on the front line at the moment in private hospitals are struggling to get any clarity. So we've just got to hold our heads up high. We've got to carry on doing what we're doing. We've got to fight another day. We've got to carry on doing all the procedures and taking all the precautions that we've taken for the last year, and we'll wait our turn. You know, we've got to be civilized. We've got to let the society carry on as it's going on. We can't go and camp out at a hospital with over 2,000 people and put ourselves at risk. So if we have to wait another week or two, we'll wait another week or two, and hopefully by then we'll be able to get vaccinated.
Right. So at the moment, there's 2,000 people waiting at the hospital, and they're trying to disperse that crowd and Baragwanath is not working because it's Sunday.
Yes, so we don't work on Sundays. It's unheard of for the public sector to work on a Sunday.
And the medical profession as
pandemic.
well, because
right.
during the pandemic, it's why work on a Sunday?
I feel like you're being a little bit facetious. I'm not sure.
I actually am outraged, honestly outraged on your behalf and on behalf of the nursing staff, of people who have been, you know, I've had insight into what you are going through and what your colleagues are going through. And I am absolutely astounded at the horror of how this has been treated. We're the medical aides with this. You know, you're obviously contracted to a lot of the major medical aides. Have they communicated with you? Are they trying to assist?
As I said, the only people who've heard from personally is Netcare. Haven't heard from anybody else, from none of the medical aides, from nobody else at this point in time. They might have things in sort of which they're busy procuring or doing, but they haven't communicated to us what is actually happening or what is the forwards plans with this. So we have to wait. But as I said, and I will say it again, I know for a fact how hard Netcare has been fighting for private doctors to be included in the actual vaccination program. And I do think it is ridiculous, because whether you're private, whether you're public, we're all fighting this. We're all fighting the same.
Well, I love it, because we're all in this together has been the slogan the whole way through. Only we don't seem to be, do we?
No, we don't seem to be. And it's going to be a very interesting step taking it forward for NHR, because, I mean, if you can't look after your private doctors, then how are we expecting NHR to work at a later stage?
Yeah, well, I'm not often speechless, but this one really does leave me just a little bit gobsmacked, I have to say. All right, let's just try and move on from that and talk about the actual vaccine, the Johnson & Johnson vaccine, in terms of efficacy, in terms of the results that we're seeing.
So at the end of the day, the whole issue with the vaccines is related to the variant that we're seeing in South Africa. And we need to know that this variant is covered by the vaccine that we are going to be administering to the people, and more so to the people who are in the front line, and more so to the healthcare workers, the people who are at high risk, as well as the people with comorbidities, as well as the people who have got a higher risk for getting infections. And the studies have shown that the Johnson & Johnson has got a high efficacy against moderate to severe, to hospitalization, to preventing death, have got over 85% efficacy, and that is the trial vaccine of choice. And I say the word trial vaccine of choice is because at this point in time, Johnson & Johnson actually donated over 300,000 of the vaccines to be used. And in order for healthcare workers to be vaccinated, they have to go onto the so-called trial. It's called the Sasonke trial, where you give your sort of agreement to be vaccinated with the trial Johnson & Johnson vaccine.
So, and are we seeing any results around in terms of efficacy for the variant with regard to Pfizer, Moderna, and all of the others?
So Moderna came out with a statement a week or two ago saying that they think they're going to have a good result against the efficacy of the variants. Pfizer is still coming to the party, but it does look like there will be changes throughout the next few months of the different types of RNA vaccines, that they'll be able to adapt them towards changing towards the different variants. The point is that if you have had the vaccine now, the Pfizer vaccine, you aren't 100% guaranteed to be protected against that variant. So we're still going to wait for more data against that.
Leanne wants to know, has any research been done with regard to giving young children the vaccine?
So the trials were done on people over the age of 16. They haven't done much research on pregnant women, and they haven't done much research on the younger children, which I think they will do at a later stage. Right now, the priority is vaccinating the elderly, vaccinating the people with comorbidities, vaccinating your healthcare workers. And once those people have been vaccinated, I think they'll look forward to doing other trials to see whether it's safe or efficacious in younger children. Obviously, if you've got a younger child of the age of 15 or 16 who's got comorbidities, who's got immune suppression, it's a different story, and that needs to be discussed with your doctor or with your specialists to decide what are the actual values, or is it worthwhile vaccinating somebody where there was no trial data to show if there was any efficacy against that age group.
Right. Craig wants to know, what does one do if there are obvious symptoms of COVID, maybe exposure, but that your tests show that you are negative?
I think it's a good question, because we do know that the tests can show negative results, especially if there's a low viral shedding. It doesn't mean that you're definitively negative. You can still be positive despite a negative test. And if you've got the symptoms, if you've got a loss of taste, or you've got a loss of smell, or you've got the fever, or you've got the cough, or you've been in contact with people, and you assume that it is SARS-CoV-2, then rather just isolate for the 10 to 14-day period. Look, we also got to remember that there are other diseases around. There are other infections that can cause you to be sick. But we are in a pandemic at the moment, and we are in an environment where the predominant infection is a SARS-CoV-2. So we've got to make that our predominant school of thought. But that being said, don't forget there are other infections. But the safest thing to do, or the safest way to play that forward, would be to then isolate yourself for 10 to 14 days until all the symptoms go away.
So it's quite interesting, because Mandy says a person that I know went to the doctor with symptoms. He was sent for a COVID test, which came back negative. The doctor advised them to stay home for 4 days just to make sure that it isn't COVID. He said that that's how that seems to be becoming standard protocol.
Yeah, I'm not sure about that. I mean, we know that the virus replicates within 5 to 7 days, and the 10-day period is a bigger sort of extrapolation of that, and it's a safer time period. So 4 days isn't really a safe time period, because you don't know where you are in the cycle, where your exposure was, what type of contact you had. You know, if you've been in contact with somebody and you wearing a mask and they wearing a flimsy mask, and you've been in contact with them for more than 15 minutes, it's highly likely if they're positive, you will basically get infected with the SARS-CoV-2, whether or not you'll be asymptomatic or not, or whether or not you have symptoms from this whole thing, we don't know. But you've got to be careful, and I don't think 4 days is enough.
All right. Romy says, I'm expecting American visitors to come and stay with me for a period of 2 weeks in July. And they've had all of their vaccines in order to be able to travel. My concern is that my family will not have had the vaccine by then. How safe is it for my family to have them stay in our home?
So I think that's also an excellent question.
Great
And I'll
question.
tell you
Yeah.
why. Is because it's not only about your family, it's also about them. We don't know, and all the studies that were done, because this vaccine has been made so quickly over the last few months, they only looked at certain parameters. They actually haven't looked at whether or not once you've been vaccinated, if you can actually still transfer the virus to other people. So them being vaccinated doesn't mean they can't transfer the virus. Those studies aren't out yet. We don't know. The second point of it is depends what vaccine they've had. Have they had the Moderna vaccine? Have they had the Pfizer vaccine? And are they themselves safe against the different variants? And I think those are things that need to be addressed before other people come from different countries and stay in your house. You've also got to look at, are you yourself immune suppressed, or have they got immune suppressive sort of conditions, or have they got comorbidities? So it's not so simple as just saying people who've been vaccinated can come to your house. And that's the whole reason why we're saying once people are vaccinated, you still need to wear your mask. You still need to have social distancing until further studies come out showing whether or not you can transmit the virus once you're vaccinated.
Right. And Rochelle says 8 weeks post-COVID, no COVID pneumonia, clear x-rays and ECG. What would cause my shortness of breath, chest pain, pressure, tightness after sitting or standing for 15 minutes, other symptoms such as muscle weakness and fatigue? And she says, although I'm a mom and I work full-time, I'm pretty used to fatigue, but this is a different level. She says, I also have a strange sensation down my legs on rest with twitches in the solar plexus. It sounds awful. What can I do? She wants to know.
So basically, it sounds like what we call long COVID. And we've discussed this before. Long COVID can present in multiple ways. You can have respiratory presentation where people get fibrosis of their lungs, where they get coughing, where they get shortness of breath. A big thing we're seeing is the neurosensory presentation, where people do get pins and needles, or they get sensations down the sides of their body. And of course, the neurocognitive things is the post-traumatic stress disorder, the anxiety, the depression related to all of this. So just because it's 8 weeks down doesn't mean you're not going to have symptoms, and you don't have to have had the respiratory symptoms to have long COVID. We don't know how long the long COVID can last, but these are documented things, and you can speak to your doctors about how to treat the long COVID symptoms or the symptoms. There are lots of studies out there that are being done, and lots of treatments that are being sort of put out there to try and treat these symptoms, to try and help decrease the actual sensitivity of the nerves and actually the sensitivity of the body to the follow-up of the SARS-CoV-2 virus.
I understand why it's neurological. We always, for everything that I've certainly thought is it's respiratory, but somehow there does seem to be a neurological elements involved.
You see, basically what happens is the virus also attacks the nerves. And that's why it becomes neurological. In the same way where you lose a sense of smell, it attacks the olfactory nerves and the olfactory cells, which are the nerves for the smell. It's a nerve. It's a neural-related process. So therefore, it will attack other nerves in the body. We all just speak about the ACE2 receptors and the spike proteins and the respiratory side of it, but there's a whole nother world to COVID. There's gastrointestinal symptoms, there's neurological symptoms, there's cardiological symptoms. There's a whole other sphere of things that someone can experience, not only the respiratory. The reason why we speak about the respiratory so often is because those are the more serious cases that land up in hospital in ICU and that are ventilated. And I think that takes up more of the discussion. But for the long COVID, the neurosensory and the cardiac and the GRT side effects or consequences or sequelae of the virus are what causes the problems.
How should somebody with long COVID be managed? How concerned should they be? Who should be looking after them in terms of a medical regime or person?
Look, as I've said before, we're very blessed in this country, and especially in Gauteng. We've got a great Gauteng GP forum of practitioners that are working together as a team, that they're all on the ball, they're all bouncing ideas off each other. They are fully equipped to deal with
so they're sharing
long
each other's
COVID.
experience.
100%. If it becomes more dramatic from a respiratory point of view, if the person can't breathe well, then you send to your pulmonologist, or then you send to a specialist who can look into it and do further testing and other types of necessary evaluations to decide what type of treatments will be necessary for that treatment. And there are lots of people who have got respiratory complications from COVID that do need long-term corticosteroids, that do need things like colchicine, that do even need things like antihistamines as part of the whole treatment process, but that needs to be evaluated on a long-term basis.
Right. So it's very important to be in contact with your GP around all of this. Adrian Gore earlier last week, spoke about from Discovery, spoke about the number of unexplained deaths in South Africa. What's your take on these numbers?
Look, I think we've highly sort of undercalled the number of deaths from COVID. We don't know how many people who didn't go for testing died from COVID, who died at home, who died alone, who died from other sort of side effects, other symptoms from the actual virus. So I think we have undercalled it a lot. That being said, every single patient that comes into hospital that dies from a motor vehicle accident and happens to test positive is also called COVID positive death. So we've got to find the balance between the real COVID deaths and those that are consequentially found to be COVID positive.
Yeah, and I think that's, but the numbers presumably are significantly higher than the official.
Yeah, we do believe so, 100%.
Right. And just looking at some of the other questions on some of these other questions, Ikwane on Twitter says, please, can you give me your thoughts on blood donor serological studies? I think we mentioned that briefly last week, but maybe you can just go over it again.
We did mention that last week, and that was studies done in the Eastern Cape, KwaZulu-Natal, the Free State, of a number of blood donors that were tested for antibodies. And they found a large percentage of people had antibodies. In fact, they found that non-Caucasians had a greater propensity towards antibodies than Caucasians. And they do believe, extrapolating from those studies, that up to 50% of the population has already got antibodies.
In the Eastern Cape?
We've got to wait and see. Well, in the Western Cape, the KwaZulu-Natal, Free State, amongst other places. Interestingly enough, those studies weren't done in Gauteng and other places. I'm not sure why they didn't do them.
Because we don't work on Sundays. We don't work on Sundays.
Right. And today's Sunday, so we wouldn't be able to do that, right?
Yeah. It's obvious. I don't know why you had to think about that for a moment, right? But it is fascinating, nevertheless.
It is, and it's very interesting because, as you say, we know of a lot of asymptomatic people that have had the virus and that were presented with obviously no symptoms, and they have developed antibodies. We do know that people who have the more severe virus do develop a higher titer of antibodies, which is a high number of antibodies, and we're not sure how long those antibodies last. We're not sure if they've got the T-cell immunity for a longer period or if their body will remember the virus for a longer period and attack it. But once again, we do know that the best form of fight against this is to be vaccinated.
Right, which we could do if it was.
Just not on a Sunday.
Just never on a Sunday. That should be the title of this podcast, Never on a Sunday. All right, so I want to talk about something else. Primarily, it obviously will be of interest to our Jewish listeners. It's a Jewish festival of Purim coming up. That said, it actually, what we're going to be talking about pertains to any festival or no matter what religion you are at different times, whenever you're celebrating. But on Friday is the Jewish festival of Purim. And there's a lot of concern around people's behavior on Purim. We know that in other parts of the world, in the United States, in Israel, Purim was the catalyst because people were getting together for the kickoff of a very, very deadly first wave. Can you give advice to South Africans and people listening around the world as to how to conduct themselves coming Thursday night and Friday?
So I think you've got to be very careful. As you correctly said, this was the catalyst last year to start the exponential spread of SARS-CoV-2 spreading throughout different communities throughout the world. And the festival of Purim, as we know, is quite a jovial, communal festival where everyone gets together, everyone imbibes, everyone has a good time, everyone socializes. And this is not the time to do that. This is the time to take a step back and say, okay, we know that this is a very jovial event, but we've got to be responsible now. And we've got to make sure we don't spread this virus any further. And to have small religious gatherings outside reading the Megillah, which is the book that's read over this holiday, it's got to be done properly. It's got to be done in the right way. You can't have parties. You can't have people gathering. Look, we do know that social gatherings are not allowed anyway. Religious gatherings are allowed, but they've got to be done in the right amount of space with the right amount of people wearing your masks. And we've got to cut out alcohol this year. You've got to cut out all the catalysts that can cause people to lose the inhibition. And I think that's very important in this state. And there's lots of customs on this holiday where there's a custom of Mishloach Manot, which is giving food or different food parcels to other people. And I think we've got to be clever for the first time and actually say you don't have to give these food parcels to 100 people. Choose 2 people, limit your spread of going out to people and going to other people's houses and interaction. Let it be something more special for your kids and for family to actually curtail the spread of the virus and keep it sort of in-house. And if you are having anyone over at your house, which you shouldn't be having, if you are having, let's say, one family, social distance, wear your masks, keep it outside, but do things responsibly, do things right. You know, we have to take the bull by the horns now. And a number of doctors put out a letter last week to say that we have to be responsible. We have to actually have the community's best intentions at heart here and do things properly. And if we have to miss out on the joviality of the celebrations from a mass point of view, so be it. A number of organizations are doing celebrations, but they're doing them very cleverly. They're doing them as drive-through events where you don't get out of your car, you're not exposed to people. And I've got to take my hat off to people like organizations like the Chevra Kadisha for doing something like that, because I think it's very clever, it's very well done, and that's the way to keep the community safe.
Mm-hmm. And it's really just the letter that I saw, you were a co-signatory on it, a number of doctors involved in treatment of people in the community with COVID, really begging, pleading for people just to be careful. I heard Rabbi Johnny Glass yesterday saying a very clever thing, I thought. He said, if it feels normal, if you go to synagogue and it feels like a normal Purim, go home. Because it shouldn't be feeling normal. It shouldn't be feeling,
100%,
it shouldn't be what it normally
correct.
is. And I thought that was very smart, and I thought very clever. I'm really very hesitant to ask you for good news, considering Liverpool's somewhat lackluster performance.
So the good news is as follows. Okay. Yes, albeit it's circus and it's a frenzy, they still have dished out over 10,000 vaccines, 10,000 more than we had last week Sunday. The numbers are down. The matric results have come out, and our kids have done wonderfully. They've risen to the challenge. They've done this throughout extreme times, so well done to them. People are looking after each other. Purim's coming up. We're going to look after our own interests, and we're going to be responsible. And with regards to Liverpool, I think people are forgetting one thing. There's only one red English team still in the Champions League, and we won our game this week. So unlike other red teams that are not in the Champions League, we are in the Champions League, and you will never walk alone. And for my quote for the podcast, you can't start the next chapter of your life if you keep rereading the last one. So just remember to be safe, look after yourselves, have a safe Purim. Don't spread the virus. Don't over-imbibe. Just look after yourselves, look after your children, look after your families. Keep on wearing your masks, keep on social distancing, and never walk alone.
I'm Howard Feldman. This has been a Sunday Synthesis podcast. Please don't forget to subscribe on the button below so that you are alerted every time we publish one of these podcasts and others. In fact, we have some fantastic podcasts at Synthesis tomorrow, and it'll be released later this week. I'll be chatting to Michael Shapiro, who's the managing director of Synthesis, along with Gidon Novick, and an incredible organization called SA Harvest. And they're doing really the most remarkable work in South Africa during the time of COVID, helping people who need it desperately. So don't forget to subscribe and listen out for those podcasts. Have a fantastic day. Be safe. Well, there's not much to do because it is Sunday, and most of us just simply don't work on a Sunday, especially during a pandemic. God bless. See you next week.